The most challenging part of going through with my wife is just making sure that I'm there for her. She's dealt with doctors that won't listen, or doctors that give a diagnosis that means nothing to her symptoms, and that's really frustrating for her. Making sure that I'm there.
The hardest aspect of seeing Claudia go through this is not knowing how to get her answers.
I would say the most challenging thing going through this journey is being kind of helpless.
I would have to say the most challenging part is, well, because it's an invisible disease, an invisible illness, and you just want her to be back to normal. She's been dealing with this CSF leak for about 10 and a half years, and it's just difficult. We don't want her to lose hope.
And this disease really changes you on so many levels. So even though it can be hard to see your loved one struggling, or it can be frustrating when your loved one can't support you in the ways that you may be used to, or can't remember some of the things that you might have told them, or whatever the case may be, like just to remember that they're fighting their hardest to recover as well, and to try and just stay patient and loving towards one another.
Be patient. A lot of times they have a hard time expressing what they need or what they want.
To understand what they may be thinking and feeling, and most of all, pushing the envelope and being their best advocate.
And for caregivers to be accepting of their situation and not just look at her at the way she looks, because she looks normal. She looks like nothing's wrong, and we want so much for nothing to be wrong, but it is, and for just us to accept the way she feels.